Sir, we are live now.
Okay. You want to start?
Yes, sir, you can start.
Do you want to say something about me, or you want me to say something about myself?
You need to introduce yourself, sir.
Okay, fine.
Yeah.
So welcome, ladies and gentlemen, to this one more round of Med Talks. And I thank the IJCP for arranging this. This is on a very vital subject. We are on Valentine's Day today. And I think it's high time that we establish close bonds with our less fortunate brethren, those who are waiting, needlessly blind, waiting for corneas, which are in short supply. I am Dr. Quresh Maskati. I'm a cornea specialist and eye surgeon. I passed out from KEM Hospital, Mumbai in 1983, and I've been president of various societies, the Bombay Ophthalmic Association, Maharashtra Ophthalmic Society, All India Ophthalmologists Association Society, and the Cornea Society of India. But by far, my favorite talk, I've given talks all over the globe, all over the country, both professionally to eye surgeons as well as to family physicians and the lay public. And wherever opportunity arises, I normally would like to talk about eye donation. So without further ado, I will share my screen and I'll talk to you about a subject very close to my heart, and that is eye donation, what every family physician should know. So if you see the pictures there, that is the cornea, which is cloudy, and the transplanted cornea, which is so clear and restoring vision, the before and after pictures. Since we have just half an hour, I will try and crowd a lot of information like the crowded bus there, and hope that you will forgive me for going a little fast at some places. So first of all, is there a need for eye donation? Yes. In Asia, over 1 million patients await corneal transplant surgery, many of them children and young adults. However, the total number of eyeballs collected per year from India is only 50,000. So that means only 25,000 people have donated their eyes. And it's estimated that for every eyeball utilized to restore sight, over 100 more patients are waiting for the same gift. Unfortunately, people are buried in fancy caskets or in graves, or they are cremated with their eyeballs and corneas intact instead of them being donated. That is why this big mismatch between numbers. So is the whole eye used for transplant? See, these are some questions which your patients will ask you, because you're the one who will fill up the cause of death for a patient who's died at home or wherever. The patient is well known to you. And when you suggest to the patient's relatives that why don't you donate eyes, whole lot of questions they will ask you. So I want you to be an expert on this so that you can answer every question. Is the whole eye used for transplant, they will ask. So you tell them no, only the thin transparent layer in front of the iris or the brown of the eye, which is called the cornea, is used for transplant to replace the diseased or opaque cornea in the eye of the patient, the recipient. So you can see that the cornea, the front portion of the eye, the anterior portion, is the one which is cloudy here in this picture on the left. And with a corneal graft, only the cornea is changed and the patient can see beautifully afterwards. So that's a clear graft. What about rejection? Does the human body reject the transplanted cornea? If I donate my father's eyes, what's the point? It will get rejected. Kidneys get rejected. No, the human cornea doesn't have any blood supply, unlike the kidneys and the liver and the lungs and the heart, which are donated. Hence, the risk of rejection is very low. Rejection, if it occurs, can be suppressed by timely medication. In general, the chances of success are greater than 80%. You see the picture there, 2 years after surgery, looking very clear, the front portion. And the next picture is 20 years after surgery, another patient of mine, where you can't even tell that there has been any corneal grafting done because the stitches are there, sutures are removed after a year or so. So what is new in corneal transplants? In corneal transplants, previously we used to change the whole cornea. As you can see the eyeball picture, the whole cornea, central area of the cornea, which was opaque, was removed, and what was called a penetrating keratoplasty. Penetrating because it penetrated all layers of the cornea. A new cornea was put in from a donor. As you can see in the middle picture, the whole cornea, central cornea, was removed and changed. But now if the anterior portion is damaged, we change only the anterior portion. That's called deep anterior lamellar keratoplasty or DALK. If the posterior portion or the inner lining is changed, called the endothelium, we change only the inner lining. So in theory, we can use one cornea to give sight to 2 blind patients. So what about corneas which are for some reason unfit for transplant? Even these are invaluable for research and training. We train our residents how to use sutures, how to suture. In the old days, residents could learn easily how to suture because cataracts were sutured, cataract operations, but now they are sutureless. So many residents don't know how to use 10-0 nylon sutures. So we train them on these corneas which are unsuitable for transplant, and of course they're also used for research. So nothing is wasted. Now, do corneas corneal transplants guarantee sight to all blind people? No. Transplants can only help when the loss of sight is solely due to corneal defects and the rest of the eye mechanism is intact. So if you see the first picture where I put a tick mark, in the left eye, the whole cornea is opaque. You see that white in the front. And she will do well with the corneal transplant. In the middle picture, the central cornea is opaque. The rest of the cornea is clear. So they need a small central transplant. Do very well. But in the third picture, that's the optic nerve that you're seeing. The retina is one part where you can see it with an ophthalmoscope. So the nerve which should be red or pink is yellow or white. So it's an optic atrophy. So if the nerve of the eye is dead, even if the cornea is changed, it's not going to help. So we have sophisticated machines like ultrasound by which we can check the retina and the nerve. If there is a retinal detachment or the nerve is dead, then there is no point in doing a corneal transplant. It will not give them sight. So very briefly, how is the donation used? So you as a family physician will give a cause of death, and that cause of death is required. So you can, the patient can, relatives can even WhatsApp that cause of death to the eye bank. Then they will come, they will remove the eyeballs. After the eyes are removed, it takes only half an hour. After the eyes are removed, they'll be evaluated, processed, and screened at the eye bank. So this is the eye bank, not the overcrowded cupboard with eyeballs, which is an artist's impression. But it's very modern eye bank. This is my eye bank where I'm a trustee. So we screen for HIV, we do blood tests, we take some blood from the heart as well. And we then cut out the cornea. We may take the whole eyeball from the patient, or we may take only the cornea, depending on the expertise of the technician who comes to collect. And we store the cornea in a special medium, so you can see with a thin forceps, just the cornea is being put into a bottle of pink liquid. And then it is put into an ice box or an igloo, as we call it, packed with dry ice, and it can stay in that for up to 24 hours to be taken to its destination. If the patient is in Jumri Talaya and not in Bombay and is going to take 3 days or 4 days or a week to come, we have other medium called Cornisol, in which we can even keep it for up to 15 days in the eye bank. And then we take it out from the refrigerator, put it in this igloo and send it to the eye surgeon. So what is an eye bank? An eye bank is the link between the donor and the recipient or the eye surgeon. It's an organization recognized by the government to collect and distribute the eyes to those who require corneal transplants. They're mostly in the NGO sector. Most of them are, almost all of them are not-for-profit eye banks. How quickly should the eyes be removed after that? Ideally as soon as possible, but you can wait. You can, if the relatives have not yet come, they have not yet decided, they're thinking about it, up to 6 hours after death also the eyeballs can be collected. In winter months, even up to 8 hours. If you're abroad where the climate is cold, even up to 12 hours after that. But in our climate where it is hot climate, and if the patient is not in an air-conditioned room, preferably 2 to 4 hours after death is advisable, or the earlier the better. The quality of the tissue is well maintained. Does the patient have to be transported to the hospital after death? No. The eye bank has personnel who will come to the donor's home. They might come in on a motorbike, two-wheeler, four-wheeler, and an ambulance, depending on the eye bank. And it can be a hutment, a slum. It can be a palatial mansion. It doesn't matter. They will come to wherever the patient is or the donor is and remove the eyes there itself in the home of the patient. If the patient has died in a hospital, of course, they will visit the hospital as well. So who can donate eyes after death? Please understand, age is no bar. An infant of 1 year, an old woman of 100 years, everyone can donate. If the patient has been wearing high minus glasses or plus glasses, it doesn't matter because we are using only the cornea. Any patient who's had a successful cataract surgery, glaucoma surgery, retinal detachment surgery, all of them can also donate as long as the cornea is clear. Even a patient who's had a corneal transplant and the cornea is clear, he can donate his eyes so that a new person can get a cornea. The life of the cornea is 200 years, while the life of a human being is less than 100. So a cornea can be used twice or perhaps even thrice. It doesn't matter if the patient is diabetic, high blood pressure, has a beer belly, or has a heart problem. It doesn't matter. All of them can donate their eyes. Railway accident, as you can see, any cause, vehicular accident, a stroke, suicide, death by suicide, heart attacks, any cancer, virtually any cancer. We don't take neurological tissue. We don't take blood cancers like leukemias, but otherwise almost every other cancer can donate their eyes. Having said that, almost everyone can donate. There must be some people who cannot donate eyes. Who are these people? So these are WHO guidelines. Those who have got neurological conditions like rabies from dogs or septicemia, blood count, the WBC count more than 20,000, we don't collect that blood, just collect those corneas for fear that some infection could have gone into the eye. Patients with HIV, AIDS we are not permitted. Blood-borne cancers that I told you. But most important is the picture that you see below of fighting relatives. Instead of grieving relatives, sometimes you are fighting relatives. So if two relatives want to donate, but 4 relatives say no, please don't call the eye bank because we don't want to come there and then be refused. So if the family physician must make sure that all the relatives are on the same page, they need not be present. We need signatures of just 2 relatives. They need not be the immediate relatives. For example, a senior citizen passes away, his son and daughter are both in the US. It doesn't matter. It could be the 3rd cousin from the mother's side or the 4th cousin from the father's side. If they are present and they sign, that's perfectly fine. So, but 2 relatives have to sign and give consent because legally the body after death belongs to the family. It doesn't belong to the patient. What about any religion? What about any religion? I'm stressing this. Does any religion forbid eye donation? No. Please understand that eye donation is only since the last century or so, and corneal transplants only since the last century. So it's not forbidden in any holy books, as it was not practiced when the holy books were written. Certain religious leaders, such as Buddhist monks in Sri Lanka and parts of Thailand, they actually go from house to house propagating eye donation. That's why Sri Lanka, a tiny country like Sri Lanka with just 25 million population, is a net exporter of corneas. Some Muslim countries have even issued fatwa. Fatwa is a edict given by the highest priest, Muslim priest, calling for eye donation. So in places like Egypt and like places like Iran, the holy people encourage eye donation. Iran again has got more corneas than patients. So it's a fallacy that any religion forbids it. It is only how people interpret religion, and that is what sometimes causes the problem. What about the procedure? Doctor, I would like to have my father cremated as fast as possible. It's going to take 5-6 hours. I'm not interested. Is the procedure cumbersome and time consuming? Too many forms to be filled? Doctor, I'm grieving. I don't want to fill so many forms. Tell them, no, it's easy. Almost no paperwork is required. It's not cumbersome at all. In Mumbai, the eye bank team will reach within an hour anywhere in the city, and almost every place where there is an eye bank in the country, we will reach in less than that time. Procedure will be completed in just 30 minutes. If the patient is on the floor, the eye bank team will work on the floor. You don't have to lift the patient to a bed at all. Is there any disfigurement of the face? After enucleation, eyelids are gently closed. Usually no one can tell that the eyeballs have been removed. This picture that I put over here is a lady who died with her makeup on, and you can't tell that we have removed the eyes, we put cotton balls inside in the orbits, but the eye looks perfectly normal. A few ml of blood is also collected either from the vein or from the heart, because you have to test for mandatory tests like HIV and others. So there's no disfigurement. There is only one paper that the eye bank team will carry, on which they will take signature of 2 relatives, and all they need is the fact that the patient is dead. So the family physician has to just certify that in a cause of death certificate. Now, this is about deaths at home. What is meant by HCRP? That is Hospital Cornea Retrieval Program, is a sustained effort by all eye banks to collect maximum eyeballs from hospital deaths, such as accident cases and from ICUs, because the quality of the corneas is very good. People who die at home are usually very senior citizens, 80, 90. They have been ailing for some time, and their corneas are many a time not as good as a young man who dies out of a heart attack in the ICU or of a vehicular accident in a trauma ward. So we try and encourage more of Hospital Cornea Retrieval Program, or HRCP or HCRP. Let me now come to what role a family physician can play, and I will then afterwards welcome questions. So if you are if you have a waiting room, promote with posters in the waiting room. My eye bank, which is EBCRC Eye Bank Coordination and Research Center at Parel, where I'm a trustee, will be happy to provide you these posters. Those who ask you questions about the procedure, have pamphlets prepared by the eye bank. Whatever I've said just now is in pamphlets in 5 languages, which I can share with you for free, on the myths and facts about eye donation, and give it to them ready while they're waiting in the waiting room. So even normal people can have a look, and so they will remember when somebody dies. These pamphlets can be kept along with reading material in your waiting room. If you're even more keen to help, our eye bank staff can even train you and your technicians or medical staff in how to ask the relatives of a deceased person for an eye donation. There is a little knack of how to ask them. We'll be happy to train you, just half an hour, 1 hour of training. And if you would like to help us by enucleating the eyes, we don't need eye surgeons to go to the home to enucleate eyes. Family physicians are all right. Even technicians are all right. We will give a certificate. Once we train you, it may take 2 days or so of training. We'll show you videos. We'll take you along with us for the next eye donation. And then we'll give you a certificate saying that you're trained in eye donation work, so that you can enucleate. Enucleate is a technical term for removal of the eyes from the deceased. As an individual, you can talk to friends whenever you can. Whenever I go to a party, I try and veer the talk towards eye donations and talk about it. So I sensitize people about eye donation and how easy it is. If you are in a building society, you can put up posters there. Usually there's lots of space in your lobby. You can distribute pamphlets to your neighbors. If a death occurs in your neighborhood, you can mention eye donation to the grieving relatives, and you can offer to call the eye bank and arrange the whole thing. So just one phone call it takes to arrange everything. If you're a member of Rotary, Lions, etc., you can organize a visit by your club to the eye bank. We will be delighted to show them around, answer any questions. They can donate money to the eye bank because the eye bank is a not-for-profit. They can sponsor 1 or more corneal transplant surgeries for the poor. They can even sign pledge cards. Now, pledge cards is a double-edged weapon. A pledge card is something where during life you say, I would like to donate my eyes after death. We urge you, even if you take pledge cards, to ask those relatives to keep the pledge cards at home, and they can even frame it and show it to the relatives at home so that the relatives will remember it when that person passes away. There's no point in signing a pledge cards and giving it to the eye bank, because when you die, we don't know that the person has died. So we can't act on the pledge cards. I thank you so much for your attention, and I'll be delighted to answer any questions you have. To just summarize, the process is very simple. It just takes 30 minutes for the eye bank team to collect the eyeballs and leave the premises. They will only come with a single sheet of paper on which they will take signature of 2 people, 2 relatives. The family physician has to just certify that the person is dead, so that we don't get into medical legal hassles that we've stolen eyes from a living person or something like that. And it can be even sent by WhatsApp to the eye bank. In Mumbai, the iBank number is 1919, and the other the landline number is 2416-4342, 2416-4342, and you just call them up. It's 24/7 working day and night, and they will direct people, the technician, the nearest technician to the home. It can be all over Mumbai, right up to Dahisar or Thana or wherever it is. We have iBanks everywhere. And if you're listening to this from other cities or smaller towns, do try and find out which is your nearest iBank. Visit them, talk to them, take pamphlets from them, so that you're well prepared to answer your patients' questions. I've tried to answer the questions that your patients may ask you, but I'll be delighted to answer any questions that I may have inadvertently left unanswered. Thank you so much, and I will stop sharing my screen here.
Hello.
Yes.
Yeah, sir. There are some questions are there now. I will share
Yes.
one by one questions in the chat.
Please. Saurabh, you ask me the questions.
Yeah, sir. Yeah. So the first question is, can artificial tissue be used instead of a donor cornea?
Yes, there is a lot of research going on artificial tissue. There are two types of artificial tissue. One is only for the front portion, the lamellar graft, not for the full thickness graft as of now. And the second, there is a plastic cornea, which is called keratoprosthesis or artificial cornea. But to fix that artificial cornea in the eye, we need a donor cornea as well. So at this moment, we are still talking of a shortage. Maybe 10, 20 years in the future, when we will have 3D printed corneas which are coming in, we may not need so much of the human donor cornea. As of now, for the next 5 years, the need is really great.
Yeah. So the second question is, would someone with macular degeneration benefit from a corneal transplant?
No, that's a good question. As I said, only those with corneal diseases will benefit from a corneal transplant, where the cornea is not clear, whether it is opaque or it is conical like a keratoconus. They will benefit. Macula is the part at the back of the eye. Cornea is the front of the eye. Macula is the central portion of the retina. So if the macula has got degeneration, it will not benefit because only the cornea is transplanted. The whole eyeball is not transplanted. Retina transplant is not occurring as of now. Thank you.
Yeah. So the third question is, are people with glaucoma candidates for this procedure?
Yes, if the person has got glaucoma plus an opaque cornea, then the glaucoma we will control with either drops or doing a glaucoma surgery at the same time. And the cornea, cloudy cornea, can be changed. If the person is got blindness due to glaucoma, then you can't do anything. If the cornea is clear, then you can't do it. Glaucoma is a one-way street. Whatever vision is lost forever. But if it is early glaucoma, moderate glaucoma, we can do a glaucoma surgery at the same time as a corneal transplant, provided the cornea is opaque. Thank you.
So the fourth question is, would someone with diabetic retinopathy benefit from a corneal transplant?
Again, just like macular degeneration, diabetic retinopathy affects the back of the eye, the retina. So unless the cornea is opaque, cornea is cloudy, only then a corneal transplant will help. We don't do eye transplant. So diabetic retinopathy patient requires laser, requires some injections, requires some other treatment, but not a corneal transplant. Thank you.
Are corneal transplants done more frequently on elderly or younger patients?
We are doing it equally. There is a lot of youngsters who require corneal transplants, patients with low socioeconomic status, with vitamin A deficiency, with cloudy corneas. So it is more beneficial to society when we do it for youngsters. Adults get injuries and their corneas are cloudy because of injury. Children get it because of bow and arrow injuries while playing with sharp objects or scissors or knives, and they poke their eye and they might get a damaged cornea. So different indications. In adults, in senior citizens, sometimes a cataract surgery with has got complications and the cornea is damaged, that's called pseudophakic bullous keratopathy. In those, the corneal transplant is very helpful. Thank you.
Yeah, sir, the last question. What is your opinion of LASIK surgery?
Yeah, LASIK surgery is extremely safe. I have done it for my daughter as well about 10, 11 years ago. So if you're a candidate, or if a patient you know as a candidate, the patient has to be above 18 years of age and the number should have remained stable for 1 year. If these two criteria are met, they can go ahead and get a LASIK done. It's outside the scope of this talk, but still, no problem. Thank you.
Yeah, sir, we are done with all the questions now. And thank you very much, sir, for your valuable time and sharing insights on the topic, sir.
Thank you.
Yeah, sir.
Thank you so much. I thank everyone in the audience for a patient hearing.
Yeah, sir. Thank you very much. Yeah.